We're in another week. Welcome, welcome. 50,000 women have pregnancy complications. That's according to the CDC. Personally, I think that is underrepresentative. However, of those pregnancy complications, a significant amount of women will unfortunately die as a result of their pregnancy. That's maternal mortality. So, maternal mortality has a specific definition in medicine where we're looking at pregnancy related deaths during the pregnancy or 42 days after the end of pregnancy, and we compare that number per 100,000 live births. So, when you look at that, here is the data which has been pretty consistent that black women are 3 to 4 times more likely to die than their white counterparts. This has been substantiated by a lot of big institutions, including the American Journal of OBGYN and the Centers for Disease Control. So that is definite data that has been reproduced. And the data kind of lags behind, but that's up to 2021. Why does that happen though? People have long espoused reasons why. It used to be thought that it was socioeconomic, but we're seeing very affluent, very healthy black women still having the same issues as those with scarcer resources. So, why? It's barriers. It's social barriers, it's institutional barriers, it's individual barriers. But what do we define this barrier as? In my humble opinion, I think it's all related to the underlying pinnings of implicit bias, whether it's unintended or deliberate. But if we kind of look at our human nature, we kind of, we all judge. Those who say we don't judge, y'all lying. Sorry. We judge the littlest things. Some of us judge the bigger things. Some of us have some preconceived notions that they either grew up with or learned because they're in, different groups of friends or whatnot. But at the bottom line of it is that we all have some kind of implicit bias. Now, the thing is, if you, Joe Schmo, have an implicit bias when you go to pump your gas, it's not going to impact anybody, right? But when you come into the space of healthcare where it is incumbent on your healthcare providers to check their biases and thought processes and judgments at the door, because that now can have a direct impact on your healthcare and your morbidity and mortality. So that's the big difference there. So, what can we do? I think until as a species we kind of grow, as a country, we understand that we're all human and we should treat people as how we would like to be treated. We're going to have to self advocate. We're in a space right now where women's health care is under attack for reasons that I can't even begin to understand, and frankly don't have the brain space to even try and understand. But here's the thing. We have a saying in Jamaica, if if America catch cold, we come down with influenza. So if health care is impacted for all women in the United States, guess what? or marginalized people of color, women of color, we're going to have 3 to 4 times the impact. So until we kind of get our collective acts together and we decide that we're going to make a change, we have to advocate for ourselves. What does that look like? Number one, when you're going and you're choosing your healthcare doctors, um, if they're not listening to your concerns, um, then it's important for you to press pause and make them listen. Now, we can do that in a respectful way that's devoid of heightened emotions. And I know for me, when I get particularly passionate about a thing, sometimes, like I had a close associate of mine go, well, must you be so strong? So, in order to ensure that that message is not lost because what they're hearing is anger, passion, whatever, insert that space. Um, Try and prepare for your meetings. Write down your things, write down your concerns, and if you have to give it to them to read or read it yourself, good. Bring a friend, phone a friend, or a family member who might be able to advocate in a lingo that may be easier to hear. We got to just find a way. Know your warning signs, your ladies, with your hypertension and your diabetes. Please know your warning signs. Make sure your glucoses are being checked early, not after the fact. Share your updates. This is particularly important for mothers who have blood pressure issues, hypertension in the pregnancy. That hypertensive problem, now that the baby's done, you're still physiologically pregnant. So if you're going to an urgent care, if you're going to an emergency room, you have to inform them that you are postpartum X amount of weeks or you were just recently been pregnant, because that's going to shift the algorithm in the doctor's minds. Okay? So that's what I have for you. Please let us walk good. Please let us advocate for ourselves and each other. We're on some uncertain times here, and women's health care is just too important for us to turn a blind eye to say, well, it's not impacting me or my family, so I don't care. If you have a daughter, if you have family members who are younger than you, it's going to impact you. So we need to all get involved to make sure that women's health care is a right and not a privilege. Walk good. Love you all. I'm going to breathe. Don't forget to breathe. Talk to you soon.